diabetes is diabetes that develops in pregnancy, approximately around 26 to 28 weeks of gestation. And it's a little bit different than what we consider regular diabetes because the way it develops is not necessarily the same. The hormones of pregnancy essentially compete with insulin, so they create an insulin-resistant environment. So unlike type 1 or type 2 diabetes, the way it develops is different. And that's why any pregnant woman can be prone to gestational diabetes. So even if you're not at risk for type 1 or type 2, you can still get gestational diabetes. If you're thin, you're healthy, you don't have other risk factors, you're still at risk for gestational diabetes. That's why we screen everybody and not just the people who are at risk for the other types. Now, if you do have risk factors that would make you more likely to be regular diabetic, you will also be more likely to be gestational diabetic. In gestational diabetes, we generally diagnose this in the third trimester. Anywhere usually between 26 and 28 weeks, you'll have a test called a glucose tolerance test. We'll give you a load of sugar and we'll see how your body handles that sugar. So you'll get your finger pricked for blood, and that level will tell us if you're at risk for gestational diabetes. We may do another confirmatory test, like a 3-hour glucose test, to see if you truly have it. And if you do, initially we generally manage your diabetes with diet control, sometimes exercise, and just try and change lifestyle factors to help it. But some women do need medication or even insulin in gestational diabetes. In most cases, after a few weeks after delivery, the body can self-regulate the sugars and there's not as much competing pregnancy hormone. However, anyone who is gestationally diabetic is unfortunately at higher risk for type 2 diabetes later on. So we do recommend screening several months after you've had a baby and yearly afterwards in order to screen for the development of type 2 diabetes.